Oral health can be described as the well-being of our teeth, gums, and the entire oral facial system that allows us to smile, speak, and chew. However, a lot can go wrong if our oral health is not taken serious or made a priority. Some of the most common diseases that impact our oral health include cavities, gum disease, and oral cancer. Oral conditions are frequently considered separate from other chronic conditions, but these are actually interrelated. Poor oral health is associated with other chronic diseases such as diabetes and heart diseases. Other oral conditions of public health importance are orofacial clefts and orodental trauma. These are associated with risk behaviors such as using tobacco and consuming sugary foods and beverages. The WHO Global Oral Health Status Report estimated that oral diseases affect close to 3.5 billion people worldwide, with 3 out of 4 people affected living in middle-income countries. Career scientists have given a few reasons as to why your teeth have such a huge impact on your cardiovascular system. First, the oral flora, the bacteria that live in and around your teeth, gums, and tongue, can move from your mouth and into your bloodstream and eventually all around your body. Some research shows they can set up shop in and damage or affect your cardiovascular tissues. That bacteria can build up into plaque and grow in your arteries, which might not be good news. Some people are genetically predisposed to both oral and cardiac diseases, but even in that case, genetics aren't destiny. That said, there is a lot you can do to protect your oral health. Public health strategies such as community water fluoridation and school sealant programs are safe and effective interventions proven to prevent cavities and save money. Most oral health conditions are largely preventable and can be treated in their early stages. There is a lot you can do to keep your teeth healthy. Patients with gum diseases should try to reduce their risk factors and take preventive measures at an early stage so as not to clog up your blood vessels and trigger clotting. You can prevent tooth decay by eating a healthy diet, avoiding sugar-sweetened drinks, drink plenty of tap water, brush your teeth twice a day using a fluoride toothpaste, and flossing once a day. Regular professional care can help to identify and prevent decay and may avoid the need for a filling. It is important you take good care and pay attention to your oral health.
All right, you're very welcome. This is still Family and Values. Like I said, we're discussing oral health. And yes, like you heard, it's a whole lot. It is deep. In fact, I never thought it was that deep. But you know, looking at the introduction, now I know it is way deeper, could affect your whole system. But I'm not the expert here. We have an expert in the building, and his name is Dr. Olagundoye Olufemi. He's a dentist at Lasses. Welcome to the show.
Thanks very much.
It's good to have you.
Yeah, wonderful. Happy to be here this morning.
You know, asking the first question, which was behind the camera before the program even started, I said, why are people scared of washing their teeth? That we all know what the washing is, the whitening part. Some people are scared that, okay, the chemical, you know, it could start affecting them, their gums and all of that. So they prefer let the teeth be the way it is. What's your take about that?
I want to believe that that kind of perception is unfounded. You know? I mean, there's really nothing so bad about washing. You know? There are 2 ways you can wash. You can be manually done. Somebody get to the hospital, somebody helps you to manually use some instruments to clean it. You can also use a machine that just vibrates around the tooth and displaces all those deposits they have. So it's not anything.
Okay, so there's no big deal about those. There's nothing like.
Really nothing. Except probably somebody has some people who have some conditions where they wear some pacemakers. They have heart conditions.
Oh, okay.
Have people who and of course there are ways to get around those.
Okay. Okay, so generally, can you help us understand what is the basic for having a good oral health?
Oral health, yeah.
Yes.
Of course, let me define what oral health is.
Okay.
Then you know what it means. Oral health is when you know there are some structures that make up the oral structures. Your teeth, your lips, your tongue, generally all the oral facial tissues. And of course, you know, within those tissues we have the nerves, we have the blood vessels, we have every other structure, that the muscles, all of them are there, the oral facial, the mouth, in such a way that they enable you to provide some essential function such that you can smile, you can talk, you can eat, you can breathe. You know, apart from that, which is even also very important, is the psychological steps.
So there's no.
You know,
Okay.
sometimes you know it affects people's self-perception, confidence, socialization. People find it hard to socialize because probably their tooth is shaped in one way, or the color is brownish in one way, or sometimes it's crowded and all that. You find it hard smiling, find it opening your mouth. So some people just, the teeth are just moving, just shaky all over the place. So when you talk about oral health, any deviation from these, you say, okay, somebody is not
okay.
So that's what I'm saying. So when you can't smile, when you find it hard associating with people, when you already then you have problem.
Look, I have a lot of questions when it comes to this oral health, but I'm just going to take it slowly.
All right, yeah.
Yes, okay. The first thing is, what happens when someone has plagues? You know what plagues are, or maybe I'm using the bad term right now. Okay, plaque. Okay, thank God. The plaque on your teeth, and some people, I've seen a lot of people, local people, they use sharp objects or knife to remove those plaque from their teeth. So what is the best way to actually avoid that, and the best way to handle that so you don't have any more of that?
All right. You know, the best thing, you know, when you talk about plaque, plaque starts to form 3 minutes after you brush.
Ooh.
I know plaque is just a bunch of bacteria that settles around the teeth and other devices you wear in the mouth. So it starts from when you finish brushing, 3 minutes, a film of saliva forms, and in about an hour, about 12, we go to 12 to a whole day, 24 hours. You see bacteria, the first wave of bacteria invading that pellicle. We call it pellicle. That thing that forms pellicle, it invades it, forms the first line of bacterial infection there. Then after a while, they consume the oxygen available, and you find some other bacteria, the anaerobes, they don't like oxygen. They go to the deeper layers. And these ones destroy the tissues attached to the tooth. But of course, after a while, they have different colors. Some are greenish, some are yellowish, some are creamish. Look at some people's teeth, you see this line down.
Yes.
So people think, okay, let me just get it out. You use sharp instruments. But that's traumatic. They end up cutting their gum. They end up causing a lot of injury to the tooth. Not only cutting the gum, they scrape the surface of the tooth. And you know we have layers. When you scrape the outer surface, you end up with sensitivity. You know, you drink water, it shocks you.
It shocks you. You eat some food.
You're scraping the surface.
Yeah.
So it's not good at all. It's traumatic both to the tooth and also to the structures around the tooth. So the best thing is, the first way to control it, you yourself, is brush twice a day.
Exactly.
You know.
But what is the best? Because what toothpaste can you actually use? Because a whole lot of people use different toothpaste, and some of them will use it actually to maybe manage or cure whatever thing they have on their
really,
teeth.
toothpaste is more preventive than cure. Yeah, it's more preventive. You know, toothpaste, with your toothpaste and the right toothbrush, you're able to remove these deposits as they form. You know, you have 2 hours, 12 hours in between. You brush in the morning, you brush it last thing in the night. So whatever settles for 12 hours, you clear it before you sleep. Whatever settles overnight, you clear it when you wake up. So you're not allowing the wave of bacteria to come in. At all. Now, the kind of any fluoride containing toothpaste is good.
Okay.
They not really cure, they prevent. But really, in some cases, because they have fluoride, in some cases in which some parts of the tooth have been broken down, the fluoride in the toothpaste can help harden it and make it strong. And what the fluoride does is that it hardens the tooth so much so that bacteria is not able to break it down.
Okay.
Easily, as it should. And you know, you talk about cavities, you talked about cavities form when you allow this bacteria to settle
for too long.
And when they consume the sugar available, they release acid. And the acid dissolves the tooth.
Oh my word.
And if you now leave it for a long time, it eats up the tooth and becomes very large. And pain can come and all that.
So painful. Anyway, how about those that, sometimes they are cool. After, brushing their teeth, they come out, they play with you. Then after some few minutes of not talking, maybe they are working and they are not talking, and you find out that the next breath you're perceiving from them is terrible. What is the cause, and what's the way forward out of that?
Okay, when you talk about bad breath, the word there is bad breath. Everybody has a form of breath. Because if I check everyone's mouth anywhere, there are thousands of species of microorganisms.
Of course.
They are always there. They have to be there. You know. So, but when it's bad, maybe because, you know, just like say somebody closes the mouth for a while, or you sleep and you wake up, if salivary flow stops or it reduces, you know, saliva washes everything on the tooth. If it stops or reduces or it cakes on the tooth surface, there may be some smell when you get up. What you can do is just rinse your mouth and then get back, you know. But of course, when you talk about bad breath, it's a wide area. A lot of things can underlie bad breath.
But do you subscribe, because some people feel like taking a lot of water sometimes usually helps. You know, when you keep taking water, it could help reduce the bad breath or that.
Probably, you know, because of the rinsing action. You know, I was discussing some people when they asked about bad breath. I told them there are causes inside the mouth and there are causes outside the mouth. Causes inside the mouth, just rinsing and washing, they wash away. For instance, somebody that has a big cavity, you know, food will pack there, bacteria will go there and eat it up and break it down right inside the mouth. And of course, that kind of person will breathe at you and you can, the whole place is turned upside down. So, but rinsing it, you have rinsed some of these bacteria off, swallow it, and it goes down, you feel better, but temporarily.
Okay, just temporarily. Okay, all right. Now, let me ask this other side. That is about the teeth. Okay. Now, the best way one can have a healthy teeth, you just said washing in the morning and washing in the night. Now, during the introduction, we heard that sometimes when you're diabetic, it can actually affect your oral health. Yeah. How can you explain a little bit of that? How it actually affects the body? Good.
Actually, the relationship between the oral health and diabetes, we say it's bi-directional. It's two ways. You know, when one has diabetes mellitus, you know, what happens is that the immune system goes down. Okay. So when the immune system goes down, the person is prone to infections. That's one. But apart from that, you know, in diabetes, there are the blood vessels that supply the gum. They narrow. You know, we've talked about this. There's some what we call plaque too inside the blood vessels. Oh. You know, or what we call atherosclerosis. You must have heard of atherosclerosis. Somebody that is a lot of fat, and the fat is blocking the inner. Yeah. So what happens is that the inner surface of the blood is being, and the wall is being thickened. Blood supply to the gum is reduced. When the blood supply reduces, then that means the white blood cells that should go there reduces. That means bacteria swims very well and
very freely.
So the person is prone to gum disease. The teeth will be shaky. There may be pus discharging. You see bleeding all over the place. You know, it can happen. Then it also when somebody also has a poor oral hygiene, I mean, the mouth is not good, the health is bad. Somebody who is already diabetic may find it hard controlling the diabetes. Why? Because these microorganisms releases some substances we call them inflammatory mediators. They go straight to the bloodstream, and many of them go and bind insulin receptors. You know, insulin is what helps in taking care of this sugar things. Once it binds it, it doesn't allow insulin to work. So even when you are trying to treat your patient to get well for the sugar, to control the sugar, if the oral hygiene, oral state is poor, it may be very hard to control. So it has a bi-directional relationship. So that's why diabetic patients should see their dentist at least 4 times every 3 months.
Oh wow! I'm actually just hearing that part right now, because a lot of people that I've seen that have diabetes, some of them don't really take the oral health very important. Some just feel like, well, let me just brush in the morning, brush in the night, it's cool. While they make sure they take their insulin. But the thing is, now I'm just getting to know that you also have to make sure your oral health
regularly. In fact, without any problem, they have to see their dentist quarterly. Or if they have any issue, they can come to the dentist anytime. It's very important for the control of their sugar, and then to prevent worsening of any other condition. You know, many diabetics who have heart issues, and you know, this poor hygiene can also influence.
I was actually coming to that, the cardiovascular system. Now, what does oral health have to do with cardiovascular system? That one is strange when I say, like, okay, because we swallow our saliva, which you said it actually helps so that we can take down the bacteria. But now we're taking down the bacteria. Is it that is what is affecting the cardiovascular system, or what?
No, what happens is, you know, I talked about the blood vessels supplying the gum. You know, when there's an inflammation, when there's an infection, these blood vessels dilate, you're wider.
Okay.
And in any case, if you have plenty of these microorganisms, they can easily be displaced into the bloodstream. You know, not just swallowing into you go to the bloodstream. And when you go to the bloodstream, everything is going to return to the heart. So many times when you have them escape to bloodstream, they lead to infection of the inner layer of the heart. It's called infective endocarditis. It can lead to valvular disease. You know, have valves that helps in pumping in the heart. It can lead to valvular disease. Especially in people that use prosthetic valves, it's even worse. Because it leads to growth of these microorganisms inside the heart, and which is very, very bad.
Oh wow, I never know oral health could affect so much like that. I just thought it's just the up, you know, it has nothing to do with it down, but now it has everything to do with that. Okay, before we go on break, I want to ask about tooth decay. Now, let me not even go that aspect. A lot of people have pains. You know, some tell you I can't chew, and in fact, I've seen a lot of people have tooth problem, and they are in so much pain. They can't eat, they're having headache, they're running temperature, you know, the fever is there and everything. And they will tell them until you remove that tooth before you'll be fine. Now, first I want to ask, what can actually cause someone to have such a tooth pain? And of course, after removal, is there anything you want me to do post the removal to maintain, you know, because that place is exposed, I feel. So is there anything one needs to continuously do so that that place is safe and every other tooth is kept safe too? Yeah,
you know, I started with the fact that, you know, the two commonest oral diseases are the caries. You have the big cavities. You also have the gum disease. The two of them arise from bacterial deposit and infections. So when you have bacteria settling on it, usually when you take plenty of sugar, you take a lot of sweets, chewing gum, you take plenty of cakes, ice creams, all sorts. The bacteria in the mouth love it so much. So when you take it and after you enjoy it for about 10 minutes.
Some people say they have sugary tooth.
They give it a name. They say sweet tooth. Whatever.
Okay, sweet tooth.
You know, it gets to a level they think after 10 minutes you've enjoyed it, the bacteria goes to the tooth. You know, you have some grooves and rough surfaces, and they start enjoying the remaining sugar there. And by the time they release the acid dissolves the tooth. And it goes through the structures of the teeth. At the beginning, they're probably having is just some sensitivity shock. It gets to a level you have start having some pain, small pain. Later, the pain will wake you up in the night. It has gone down to the dentine and it's in the paw. After a while, the pain will be there throughout the day. You know, it gets so bad.
You can't even sleep at night.
I can't sleep at night. Sometimes it leads to an infection in the bone. You know, it spreads out to the neck, big swellings all over the place. And so it's far beyond just pain. It can lead to a life-threatening situation in which it will almost block the airway.
Wow.
So, of course, those cases we admit and then we do some surgeries. So those are some of the things. It can lead to, it has a sequelae that can lead to something very bad. We don't take care of it early enough. So if you extract a tooth, you know, it may be so bad and they say, okay, this one has to be extracted. Good. Once you get it extracted, you have a space. There are several things you can do. But it's advisable you replace any lost thing. Any lost tooth, you know, especially, of course, in the front, it affects your psychological status. And sometimes, even anywhere it affects your function, you're able to chew, it's good to chew. Because if you don't also replace, what happens is that the teeth around that place starts to move to close that space. So it distorts your dentition. The upper one will start to grow long to fill up the space.
You're not a vampire.
Because you know, nature abhors vacuum. You know, nature doesn't give room for any space. Something must fill it.
Fill it out.
So the upper one grows down to come on, and then you have a distortion of the whole dentition. So it's always better to put something there. You know, now that there are different things you can use. You can use the ordinary plastic one, which is cheap. But
which would you recommend?
I don't subscribe for that. The best I would always recommend is an implant. An implant is a structure, steel structure that's screwed into the bone, stands on its own in the bone, will carry a tooth structure on its bone, doesn't rest on any tooth. It doesn't cause any trouble, just like any tooth.
Nice.
You can have.
Beautiful. Thank you so much, Dr. Olufemi. This is very educative, I must say. Welcome back. It's still Family and Values. Like we said, we have our Zoom guest joining us, and that's Dr. Emmanuel Onyenuche, who is a medical practitioner and a medical director of Waterfalls Hospital in Surulere, Lagos. Dr. Emmanuel, are you with us?
Yes. Hello. Good morning.
Good morning, doctor. It's good to have you here again after such a long time.
Yes. Good morning. Good morning, doctor in the studio.
Doctor in the building,
Good
he's
morning.
saying good morning to you.
Oh, good morning, sir. How are you doing?
Yeah. Fine. Good morning. Well done.
Yes.
Okay, so we are talking about oral health, and my first question to you is: can oral health actually be genetic?
Can oral health be genetic?
Yes.
Oral health, although I mean we have the dentist, but for us as family doctors, we try to do more of educating the public and know when they need to see the dentist. So for oral health, we look at it more as a behavioral uh, than genetic. I know that there are
Okay.
some things people can inherit, but it's more behavioral. So even if someone inherits the best set of teeth, if the person engages, doesn't brush, like the dentist say twice daily, doesn't take time to remove those things that come plaques, cause plaques, and all those gum diseases, they will come down with um, their oral hygiene will be poor, and then they will easily get infected or any other disease that goes with it. So I would not want to dwell more on the genetic. Yes, dentition and the rest may have some genetic predisposition, but oral health has to do with care of the teeth, the gum, and every other thing that has to do with the maxillofacial, as is that helps you to smile, to chew, and you know, and all that.
Uh,
So I would
okay,
like
so
to
what?
think that
Yeah.
focus more on the behavior other than genetic.
Then I say, okay. All right, so what is the benefits? What are the benefits of a healthy oral health?
Yes, they are enormous, and both cosmetic and disease-free thinking, and even social aspect. For instance, if someone has a good oral hygiene, oral health, he will be able to smile, and the teeth appear okay. The breath will be fresh. There's nothing as repulsive as having a close conversation with people who have bad breath and all that. So, for that social aspect, there is a lot of benefit for someone to have a healthy, fresh breath, for someone to have a good dentition, then someone not to have infections, gums, not bleeding, and all the other infections that go around. So it has enormous benefits, and even to be able to utilize the teeth properly. The teeth is for chewing. If someone cannot use teeth, I mean, in fact, it can be regarded as a disability. You look at people eating fish, eating meat, chewing things, and you can't chew because of poor oral hygiene. So I think it's a big disability also. So the benefits are enormous. I just enumerated a few.
Okay, so as a family doctor, yeah. Now, have you ever come across a family, coming to you and you find out that all of them, both the parents and the children, have bad oral health? Have you come across them, and what was your advice to them? How did you manage such a situation?
Yeah, yeah, I have not come across the whole entire family. Yes, I can. You
Okay.
can have a family where people have those yes, dental issues, either cavity or all that, which we now refer to dentists go for filling and the rest. But the one that I've seen commonly is when you see the children with bleeding gums and
Okay.
poor oral health, whereas their parents seem to be better in terms of their oral health. So in those cases, we just know that it's neglect that is causing it. No
Okay,
one gives the
negligence.
children don't know how to brush properly or how to take care of their oral health, and eventually they come to clinic when it is now bleeding or painful, or they just keep complaining that their children mouth is smelling. So but I can't quite remember where a complete family have that.
Had.
Usually most times it's the children or isolated adults who come with one concern or the other.
Okay, so what, I don't know, as a family doctor, like you said now, you see some children that will come with, when you know the oral health is already pretty bad, and they will come, you know, looking for advice on the way forward. Now that is negligence on the parent side, not taking care of the child's tooth. Now in that part, what advice you actually give to people? Because I want people that are watching now, so they can actually learn not to neglect these certain things when it comes to their children's oral health. What advice do you give to such parents in such situation? Because they will tell you, he's 5 years old now, he should be able to brush his teeth. You understand? He's 7 years, he should be able to brush his teeth very well, which is sometimes not even possible for such a child to be able to brush it. And some don't even know the best toothbrush to buy for children and to buy for an adult. You know, I believe that every state has its different kind of toothbrush you should use. What's your advice to that?
Yeah, that's true. Sometimes a lot of negligence happen, but the simple rules, like they say, the 2/2 rule means brushing 2 times a day. You know, 2/2 brush in the morning, and then using fluoride containing toothpaste. And so they will tell you 2/2 rule, 2 minutes. You brush for 2 minutes twice a day. So that's 2/2. Brush for at least 2 minutes twice a day,
Okay.
and then use a fluoride containing toothpaste, and even floss. I mean, the dentist is promoting that it's good to do flossing of the teeth, so that all those germs and all those food particles are trapped in between the teeth can easily be removed. And people should also learn to wash their tongue. That is where some of those bad breath comes from. Even the way to brush the teeth, some people just brush in a horizontal manner. It's not about force. People they injure themselves because they are thinking that it's by force. But most times we understand that it's not brushing by force, but it's ensuring that all corners of the teeth or tooth, in this case, is taking care of the front, the back, the sides, you know, in a sweeping movement at a go 45-degree to the gum, and then you brush. So some of those things are very important. And then, of course, we advise that people should not take things that have too much acid. So, like the doctor said, sugary things also are not okay. They also worsen those cavities. And coffee, cigarette smokers, all those things are things that can affect one's oral health. So those are some of the general advice we give. But we see a lot of people before we now start saying, oh, you need to go see dentist, you need to do this, you know. So we give this general knowledge to people. If you brush well twice a day, at least 2 minutes, don't be in a hurry to wash off. If you brush, allow the toothpaste stay for like 2 minutes, 2 times a day, you are going to notice remarkable improvement. And the method of brushing also matters a lot. And then avoiding all those things will be very helpful. Of course, for the parents, we will tell them supervise more. Although we like to say, oh, children should begin to be independent, learn to do things themselves. But that is not that we should remove supervision. We should be able to be sure, watch them do it. Usually what we teach is, you watch me do, you then I now watch you do. You know, so once you do that, we are going to have them to be able to do it. Nothing wrong with children brushing by themselves, but they should brush in the appropriate way.
Okay, thank you very much, Dr. Emmanuel Oyenuche, for that one. Beautiful. Like Dr. Femi, like Dr. Emmanuel said, there's a pattern to how you brush your teeth. Now, because it's on Zoom, I would like you to actually show us what's the best pattern, because some people will be like, I'm rushing. They'll just like their toothpaste. In fact, less than 1 minute, he's saying 2x2. Yeah. That is him. A lot of people don't know it's 2x2. They don't even wait for the toothpaste to stay in their mouth. Once they do, they spit maybe once or twice, they just rinse and they're off. Yeah. Please, what is the best educators? We want to know, what is the best pattern to actually brush your teeth?
Well, some people, it's just a matter of routine in the morning. Oh, we have to brush, spit the stuff out and get out. But that's not the right way. Now, if you're talking about the right pattern, there are several techniques of washing. The commonest is the scrub one, but that one damages the gum a lot. It strips the gum off the tooth. So what we advise people to do is, just as the doctor has said, your brush will lie across at 45 degrees.
Okay.
At an angle to the tooth surface. And you allow the bristles to enter in between.
Oh, in between.
You press it, not just brush, you press it on the surface of the teeth lightly, so that the bristles plays into the spaces, and a little into the space between the gum and the tooth. And then you vibrate it. Not just brush it, you vibrate it fast. But by the time you vibrate it, then you sweep it out.
Oh, there's a sweeping?
Yeah, you vibrate and sweep out. And what you do is that your mouth should be open when you do this. Your mouth should be open when you do. So you vibrate and you sweep out. So your bristle will have entered in between the teeth. Because usually when you just do disruptor, it doesn't enter in between, it just sweeps on the surface.
Oh, okay.
So you sweep what's on one place into another
the other
place.
side.
Yeah. But what you do now is you vibrate it and then roll it out. So when you open your mouth and you roll from below upward, whatever you roll out will drop into the mouth, you rinse out. You do that across the same way. Then for up, you vibrate and you roll it down.
Okay.
So even with doing that, what you have been doing is trying to pull your gum to cover the tooth more, rather than pushing
it upward.
Because some people will say, okay, they said we should not brush horizontally. Okay, I'll be brushing up and down. So they close their teeth together, they're brushing up and down. So while you're doing that, you're stripping the upper gum up, the lower gum down, and then you expose them all the tooth.
Oh, wow.
So what you do is you vibrate it and then turn it, and then you rinse your mouth. Then make sure you brush your tongue very well and all the other corners.
A lot of people brush their tongue very hard, is that right?
No. Aggressive brushing too is bad. You know, you brush lightly. This is soft tissue. Just brush it lightly. You know, it will come out.
Some people will say there's this white surface on the tongue that one has to brush. If you don't brush on that white,
that's not it.
That's the thing. Like it has to be red or pink or something. I mean, like, is that possible?
They will damage their tongue. The white surface, many times they are just dead cells that has to go, and it turns itself over. You know, it strips off. You rinse it off, another one will form. If you don't eat at all, 24 hours, another one will form. You know, so it keeps forming like that.
Oh, wow.
Very
interesting. Okay, you said something about brushing the teeth and, you know, the brush you have to go upward. Now, that part where we are saying brush your teeth, the issue I have now is a lot of people will say, okay, when you even go to the market, they'll be like, this hard brush is for smokers. This soft brush is for children. What type of teeth do you have? No, use this type of toothbrush. Now, what type of toothbrush should one use, and for what specific purposes? Yeah,
generally we ask, for adults, we ask you to use a medium textured toothbrush. Now, for children, they use soft. They have their own bristles, it's smaller. The adults, you know, usually round. And the techniques for children, a little bit different, more like round, circular movement. Then when you use hard toothbrush, what you eventually get is recession. There was one of the pictures I saw. So, you know, the gum will move away because it will tear the gum and move it down because it's traumatic. So we don't prescribe hard at all.
Even if you're a smoker, like they said.
If you're a smoker, go to the clinic. At least, I mean, they'll clean for you with the machine to clean all those stains. What smokers have are mostly stains.
Okay, from the tobacco.
From the tobacco, it's mostly stains. So let them better. Some of them don't wash their clean well, so they also have plaques and calculus. You know, there are some that are plaques. Plaques are soft. The calculus are those that are hard. They're like chalk, hard. You know, they are calcified. You know, you also find them on the side.
This is a whole lot to learn. Okay, another question is, between toothpick and floss, like doctor said, which is actually the very best?
No. Don't ever touch toothpick.
Throw
it away. Toothpicks will damage the tooth.
Right.
You know, I'm a gum specialist, so anything that touches the gum, I don't like it at all.
Right.
You're talking about toothpick, please don't buy it.
Don't buy it.
It's no good at all. Don't buy it. But flossing is very, very necessary. You know, it's a thread, soft. You can just slide in between the teeth and then bring whatever is there out. While your brush cleans the surface in the morning, you have eaten throughout the day, some of your food entered into those spaces, meat, fish, and all that. Your floss, you get them out easily. So those are good oral hygiene aids. Apart from brushing, you should use your floss.
So what do you say about mouthwash? You know, some people believe that after brushing their teeth, they use mouthwash almost every day. So I've even seen someone that once he brushes his teeth in the morning, he will use the mouthwash. In the evening, he will use the mouthwash afterwards.
Except there's a strong reason for you to use a mouthbrush. You don't have to use it every day. You know, we prescribe mouthwashes for specific purposes. You know, they help to clean all these plaques we're talking about, to bring it out. But if you can brush very well, why do you need to also use mouthwashes? You know? Because some of them even stain the teeth.
Oh, really?
The mouthwash end up staining the teeth.
So, is there any ingredient one needs to look out for when you're buying mouthwash?
You know,
so you don't have your
you know, there are several types. You know, I don't want to mention names and types on air, but there are some that will use it for a while, give some brownish stains, although they are not permanent. You should brush it to go. There are some that are just mouth fresheners left to me. They don't have any much medicinal effect. You know. So it's not something you use just anyhow. Whoa,
I've learned a whole lot today. Well, because of our time, we can't take so much. I've learned that it's 2x2. 2x2 is not wood or carpentry work. 2x2 is you brush in the morning and brush in the night. And at least your toothpaste should be in your mouth for at least 2 minutes, right? Right? Yes, and your toothpaste should contain fluoride. Don't use toothpick. Throw away your toothpick and use your floss. Then you don't always have to use mouthwash. And make sure you always see your dentist, you know, for your oral health hygiene. And if you want doctor's number, you can always send a message to the number displayed below your screen TV. We'll give you doctor's number so you can actually meet with him and get more consultation and of course do the right thing by your oral health. Okay, and that will be all. I would like to thank Dr. Emmanuel Onyenuche for joining us via Zoom. Thank you so much. I really enjoyed your section, and thank you for the 2x2. Thank you so much. I learned a lot. You're very welcome. You're very welcome. And thank you, Dr. Olagunjoye Olufemi.
Thank you,
Thank you so much for being in the studio. I really learned a lot. But I would like to bring you again. We'd have to talk about this oral health in a deeper part.
Always.
And thank you, everyone, for joining.